what are some of the injuries that we should be aware of?
Most of the injuries that will happen are either because of undertraining, overuse, or because of lack of stretching.
I think if you listen to your body, you know you're overusing it.
What are some of the injuries that you very often see in your practice?
Most commonly injured joints? They are the shoulder, the knee, and the ankle.
Now, ligament tears are becoming more and more common, right? So, what is your recommendation for something as common as a ankle ligament tear?
If we break it down, it actually depends how severe was the injury to start off with. The more severe injuries will need more splinting. The less severe injuries need functional treatment, as we call it.
So most of these injuries actually can be treated non-operatively.
Why don't you tell me your views on nutrition and then we'll go to him?
If you break down nutrition, you have to break it into two parts. One is, of course, the right amount of fluid that comes in. Next part is the non-fluid part of the nutrition.
These are small things we know,
Yeah.
but we don't take care and then, bhugatte hain jab injuries hoti
Exactly.
hain. Good afternoon, everybody. This is Namita Thapar, Executive Director of MCure Pharmaceuticals. And today is a very special episode for two reasons. One, we're shooting in my city, Pune. And we're shooting with two of my friends, Dr. Sachin and Dr. Parag. I'm so excited to have you here. And the topic for today is injuries in sports, which is something that's relevant for an athlete as well as a non-athlete. So let's start with you, Dr. Sachin. And let's start with recreational sports, because that's something that we can all relate to. Whether it is playing tennis, going for a trek, a jog, or badminton, what are some of the injuries that we should be aware of? And what's the best way to prevent it?
Okay, hi Namita, and thanks for having me here. I think it's a great honor to be on your podcast because the basic thing is that we look at all relevant issues which every one of us faces.
Thank you.
So I think the main problem that we see with the recreation sport is that it's a weekend warrior kind of a sport where typically the sport happens over the weekend, and throughout the week we're working and not really exercising, not stretching, not doing all the stuff that we should be doing, which is why most of the injuries that will happen are either because of undertraining or because of overuse or because of lack of stretching, which is why you'll find a lot of injuries which are related more to the musculotendinous junction, the junction where the muscle and the bone meet, and that's where you'd find a lot of injuries. That's what I would really like to point out.
You just mentioned overuse, underuse. Who defines that? Like, as supposing I am, running a marathon has become very the in thing these days, right?
Yeah.
Who defines, if I don't have a trainer, who defines overuse, underuse, what amount of stretching for all of these sports that are recreational sports?
So who defines? That's a great question. And you have guidelines that are laid down. So especially if you want to run, okay, let's take the example of running, right? So running, you plan to do a half marathon. Let's say we are looking at someone who is 40 years old, probably is targeting a half marathon. For a half marathon in his off season, he should be doing at least about anywhere between 10 to 15 kilometers a week before he does a long run over the weekend. Again, when he does that, if he's not training enough, that becomes undertraining. If he's like doing 5K every day, when his body can't handle it, he's not giving enough time for the recovery phase, then he's overtraining. So you have definite guidelines based on the body phenotype, which will actually tell you what sort of training schedule that person is in.
Absolutely. And Dr.
Just to add on to what Sachin said is that I think if you listen to your body, you know you're overusing it. Suppose he said about a 5-kilometer run, and after 3 kilometers you are getting the cramps, you're not feeling good, your knees are aching, your shoulders are aching. You need to stop, because that's your body telling you, and that's what will define over the last 2 kilometers. You make it a stretch, that's an overuse, and that is a vulnerable time for the injuries to occur. So
I think that's a great point, that your body sometimes gives you those signals,
Yes.
but you're just kind of running around and not really paying attention to those signals.
Absolutely.
So listen to your body. Absolutely.
That's
What are some of the injuries that you very often see in your practice when it comes to recreational sports?
Yes. So firstly, let me tell you which are the most commonly injured joints. They are the shoulder, the knee, and the ankle. And these are the most commonly injured joints because in sports they are used the most, especially for any kind of overhead sports, throwing activities, badminton, cricket, bowling, basketball. You get shoulder injuries. For sports like soccer and other running sports, sometimes you get the ACL, the knee ligament injuries. And ankle is again a joint which gets injured almost in any sport or any kind of recreational sport. So these are the three most commonly injured joints, and the injury level varies depending on what kind of sport you're playing, what kind of trauma it is, whether it's just like a fall or a twist, or is it something major. So it all depends on that, and you can get a varying of injuries. What Sachin did mention, like it can be a strain, it can be a sprain, it can be a major ligament injury, or it may be just kind of an avulsion fracture as well, which we can see. So that's the kind of range
That's the range of injuries that you come across.
Yes.
So Dr. Sachin, I like going trekking in Rishikesh very often.
Yeah.
And in December, I went trekking.
Yeah.
And believe it or not, I was fine on the trek. But then when I was walking on flat land, again, obsession with my cell phone, and I twisted my foot.
Yeah.
And I got a really bad ligament tear.
Correct.
Now, ligament tears are becoming more and more common, right?
True.
Especially the ankle ligament tear. There was a doctor who told me don't do anything about it, it'll self-heal. There were those who told me to wear that foot splinter. After 3 months, if it still didn't heal, they wanted me to do an MRI. I mean, I got a lot of confusing advice. So what is your recommendation for something as common as a ankle ligament tear?
Yeah, I think that's a great point, Namita, there. And when we break it down, it actually depends how severe was the injury to start off with. The more severe injuries will need more splinting. The less severe injuries need functional treatment, as we call it. So we try and keep the joint as functional as possible, which is what we all want. We'd want you to load that joint within the comfortable range, so that when you load a joint which is injured to a lesser degree, then what we end up having is a much faster healing, because once you start loading that joint, you have more blood flowing there, you have more of the healing factors coming in there, and then that way the injury heals. It also helps prevent a lot of stiffness, which may then become a bother. But of course, if you have disruption, if the tear is complete or near complete, the two ends are not meeting each other, that's the time probably you want more immobilization, and that's when probably you were advised a walking boot, so as to say, like a ski boot,
right,
which then helps protect your joint, does not allow any untoward abnormal movement, and at the same time you can load the joint, allowing faster healing.
Understood.
Yeah.
And Dr. Parag, at what point do you recommend a surgery versus not a surgery in some of these injuries?
So that's an excellent question, because inherently no athlete wants to get operated, because that means they are 2-3 months off from their sports. So most of these injuries actually can be treated non-operatively. There are various ways to treat it. One of the things is early diagnosis. Sportsmen somehow never come immediately to a doctor, especially to a sports medicine specialist like us, and take treatment. So they try to do the things on their own, which is absolutely not recommended. But then coming to your point, which patients require surgery? If it is, let's talk about the knee. If it is an anterior cruciate ligament tear, what we call as the ACL tear, if it is a meniscus tear. So for that, we need to clinically evaluate and do an X-ray and an MRI. An MRI is very useful to differentiate whether this particular athlete can be treated operatively or non-operatively. And if it is a complete ligament tear, if it is a meniscus tear which is moved into the joint, then these are the patients who would require a surgery. And similarly is true for the shoulder. Again, an MRI is a great tool, and we as sports medicine specialists use it a lot. And then we can find out if it is a complete rotator cuff tear. Mm-hmm. If it is something like, a dislocation which has reduced back, there's something called as a deficient bone.
When would you get a rotator cuff tear?
So for
what do you do to get that
overhead sports, like, badminton, bowling, javelin, throwing. So anything which, you are using a hand, so that can cause a rotator cuff tear. Tennis while serving, all these things. And then you do an MRI. You can differentiate if it is just a partial tear or it is just like a superficial injury, and then you rest it, it becomes all right. And then similarly for ankle, if you have a major tear, which is the anterior talofibular ligament, ATFL, it's a very common thing, or a tendo-Achilles tear where the ends are apart. What Dr. Sachin said was absolutely right. If they are near each other, you immobilize, it will heal. But then an MRI is a great tool to differentiate which athletes can be managed with surgery and without. And it's an important investigation in our armament area.
Any thoughts? Because surgery is such a big decision.
I know, that's correct. So, taking a cue out of what he just spoke of, he spoke about various injuries where you have a tennis player. So very frequently you would find that if they don't stretch adequately, if they've not trained their muscles, if they don't have their body balance correct, all of these small bits and pieces will go into propagating that injury, which then leads to an eventual tear.
Right.
So nip it in the bud, like everything else. You've been very successful with all your other campaigns where
Yeah.
you've stressed upon. Let's not get to the point where we need to treat them, but
Right.
let's try and prevent it. So prevention is the key here. And if you have a good trainer who looks after your technique, who looks after the exact amount of training,
Right.
and who advises you with the correct nutrition, which is so important, especially after the age of 25, when your body metabolism starts going the other way around. After the age of 35, our body metabolism starts going a bit reverse, which is where all these three factors have to be factored in. And that's where you really need a good coach to help you out of and take you out of this crisis.
You touched on a great point.
Okay.
Why don't you tell me your views on nutrition and then we'll go to him? Because that's a very important thing, nutrition to prevent injuries.
Absolutely. So let's look at nutrition as a whole now. If you break down nutrition, you have to break it into two parts. One is, of course, the right amount of fluid that comes in. And then the next point is the non-fluid part of the nutrition. You break down that non-fluid part of the nutrition, of course, you're going to break it down into protein, carbs, and fats. I mean, that's the standard way you break down your macros. What is that you need when you are playing sport? Of course, you need a lot of protein because you want to build muscle. You want to maintain your bone health, and that's where everything comes in. You need carbohydrate because you need that energy. And of course, you need some fat store. If you're trying to do long distance running, you need some store there which can be mobilized very quickly. The basic problem that happens is that I see a lot of people who don't pay attention to their daily macros,
Right.
but try and make that over by eating a protein bar or having a protein shake and not eating throughout the day. And then suddenly they feel that, I've got my required daily requirement as a tick box and
Right.
I'm through it. Sometimes I feel that if you're serious about your sport, it's not a bad thought to get a good nutritionist involved in your planning so that you really don't reach a point where you feel that, oh gosh, I could have done this earlier 5 years ago.
Right.
Yeah.
But supposing you cannot afford a nutritionist
True.
and just want something that's more sustainable, then everybody knows you got to have your carbs and your fat and protein. But when you're an athlete and playing a
Correct.
sport,
Correct.
should you increase the percentage of one of these three a bit more or the quantity you eat a bit more? So in terms of the proportion or mix of these three versus the total calories, are there any guidelines you'd like to give?
So if you look at the protein for a normal non-athlete, it's
Yeah.
usually about 1 gram per kg body weight per day.
Correct.
Once you're an athlete, correct, or you're a recreational sportsman, let's leave the word athlete out for now because they are managed completely differently.
Yeah.
Then you have to bump it up to 1.2 to 1.5 grams per kg
Of
body weight per
protein.
day. So that needs to come in your diet no matter what.
Got it.
And we all have smartphones. Smartphones have got fantastic apps on them. And you can just enter what you're eating every day, which tells you whether you've really ticked off the boxes or not. When you come closer to the competition, you need quick burn energy, which is when you need that extra boost of carbohydrate, which could be as simple as eating steamed potatoes, or you can have bananas, and that gives you that extra boost. And last but not the least, you can't forget the micros, correct, which is your calcium, your potassium, your magnesium,
Yeah.
your boron, because all of these are extremely linked with muscle health and bone health, and they need to be taken care
Make
of
sure the
as well.
supplements are taken on time.
Absolutely.
Dr. Parag, I want to now
Yes.
shift to something that...
Just before
Yeah,
that, to
please.
add a little bit of nutrition, I feel nutrition is the cornerstone for any kind of sport. You have to have the proper nutrition to be able to really do well, perform well, even though you're a recreational, an athlete. Diet forms a very important part.
Yeah.
And Dr. Sachin gave a lot of information about that. I would just like to say that, depends on what type of sports you play. The nutrition also is definitely important in that particular way. If you're going to do more of weight training, you need more proteins. If you're just into more cardio, you're a runner, you need more of carbs to sustain that energy and fats to, have that storage of energy whenever you need that. So it all depends, and I think it would be definitely worth it to really study about nutrition. And today, apps are there and there's so much of knowledge on the internet. I feel if you can just look it up and use it wisely, then the nutrition is going to really make you a performer, even though you're a recreational athlete, and make you enhanced in what you're doing, and your outcomes are going to be fantastic. It also is important after the sport what you eat.
Right.
When do you eat? How much do you eat? And one quick word on these protein supplements. I'm not a great fan of them because there are those protein supplements which are available that you don't know how they are made and what they contain unless you are sure of the source and the company don't take them because they come with their own set of problems because of protein. So that's my take
What
on
are some of the
nutrition.
problems you've seen with the wrong kind of protein
I've
supplements?
seen increased uric acid.
Okay.
That causes gout.
Gout is a very big thing these days.
Absolutely, that
Absolutely.
is something which we've seen. We've also seen that really doesn't help, and they're spending thousands of rupees on that, and they're still getting some muscle aches and that because they're not taking the right protein, and the muscles are not really bulking up to what the exercise that they're doing, and they're more prone to injuries also.
Right.
I've seen that.
So I think that's a good point because while you can take the supplements, just be very careful of the source and the company and go with something that's more trusted.
Yes.
Now let me come to my favorite question as a mother because I just came back from my son's soccer match.
Okay.
This heading this ball has become a big fashion statement.
Yes.
Yeah.
But I've seen concussions are becoming a bigger and bigger thing these days. So tell us a little bit about concussions and what we can do about it.
Yeah, that's a very big thing in sports, and concussion in sports is now seen more, especially with the sports like soccer, American football, and other things. Whenever, and it can happen in two ways. There may be either a direct injury to the head causing a concussion, or it may be just a whiplash injury where there is little movement inside your skull. The brain actually moves a bit because of the sudden whiplash, and this is what is called as concussion. It is not a very big kind of a head injury which you get in vehicular accidents, but it's just that the brain gets injured, and one has to see what level of symptoms it is producing. Now a concussion is something which will cause maybe a transient loss of consciousness. Sometimes you may get vomiting, nausea, headache, you may be a little confused, you may feel drowsy. So I think the coach or whoever is there at that particular time when this happens has to act really swiftly. What happens is after a minute they feel good and they might want to go on, but there's something called as a lucid interval where the concussion is there and the activity is happening and the brain is getting injured and you're still continuing playing, and then that can be disastrous. So I think any of these symptoms which are there, we need to stop the sportsman from playing that sport, take him out, if necessary, take him to a hospital and evaluate him further. And for this there is something called as a SCAT. It is a sports concussion measurement tool, and we measure that, and there are various kind of scores. So if on the ground that score is below 10, then they can continue. If it is above 10, then you need to investigate further, probably a CT scan or whatever. But it should be taken seriously. You cannot really let concussions go and think it's nothing much, and because within a minute the player is actually normal.
Yeah, and I'm really glad you pointed this out because again, this is the mom in me coming out because I've seen so much of that in soccer matches, and then the mom in me is like, no, but just go make sure it's okay, but then they go right back to play. I'm glad you touched on this topic. Any views on
so
this?
I think concussions is become so important now. So if you've watched any of those IPL cricket matches, anybody gets hit, the physio runs out, he gives them a concussion test, and only if they're good they go out. So it's now being realized that concussions are important in every aspect of sport. Cycling, they fall over, they get a concussion test. So right on. I'm very happy that you touched upon this topic because everybody talks about knee ligament tears, everything else. This very important, let's say, threatening complication never gets touched upon.
I so agree with you.
Yeah.
But Doc, let's go on to the other part of sports, which is a lot of times people ignore not just the nutrition, but the the environment, the clothes, the shoes. These are things we really don't pay attention to. So what are your thoughts around that?
Wow, that's really important. So as you start moving ahead, our Pune is very warm during the summer months. It's wet during the monsoon. Again, it's sort of moderate during the winters. So let's say you're doing an outdoor sport in the summer months where the temperatures now are as high as 40, 42, 44 at times. You will sweat a lot. Here comes the importance of clothing. So now you have all these dry wick clothing which is available very easily, and the whole purpose of doing that, it does not allow your skin to get dehydrated very quickly. So using the right kind of clothing is absolutely critical. We all know that we should wear a hat so that we don't get the sunburn directly on our face, our dehydration, or we start losing less water once we cover our head. So all of these are critical and important. Again, when you're playing in the cold season, we need to conserve heat, we need to retain that heat, which is why an extra inner layer which helps put the heat down or keeps it within becomes absolutely important as well. So clothing has made a huge difference.
Right.
Shoes, they're all over the place. Shoes are all over the place,
Yeah.
trust me. And I think probably they beat women's jewelry now, if I can.
Yeah, especially the limited edition ones.
I know, seriously. So they come
Yeah.
in all shapes, all sizes, all colors. But let's break it down to the type of foot that we have. So typically, if you break down a foot type, you have three types. You have the flat foot or the pronated or the overpronated foot. You have the
Right.
normal arch and you have the high arch foot. And depending upon what foot you have, especially if you are going to be engaged in some form of activity which has an impact where you're running,
Right.
then you require the right kind of footwear. As you start going more towards pronation, you need a thinner shoe, the so-called minimalistic shoe as it is called. As you go more towards the high arch, you need a more firm shoe which will help support your high arch, which is so very important here.
But are these shoes available, or you make insoles that suit these different
So
kinds
if
of
your
feet?
if your foot arch is really pathological, then it's always a good idea to seek an expert opinion of someone who prepares these insoles, where we make you stand on pressure mats, get a pressure impression, and then mold or customize that insole according to the shape of your foot. But if you're like mild to moderate, then you have a lot of good designs available off the shelf, and be very picky when you choose your shoe. It's not like the most shiny shoe is the best or the one that is most expensive is the best. Take your time, wear 3-4 types of shoes, walk around, jog around in them, come back the following day, try it again. And it's not necessarily that the most expensive is the best one.
Yeah.
It may be the other way around completely as well.
But again, at the cost of ignorance,
Yeah.
let's say I love running on the treadmill.
Yeah.
And I've gone to a shoe store and tried 3 shoes and I'm walking and trying to run in them.
Yeah.
What are the 3 things that I should look for to know that this is the right shoe for me, other than, them having that rack saying shoes for running?
Correct. That's
Which again has 20 options for me.
absolutely correct.
Yeah.
So the first thing, it should feel comfortable. Correct. So let's go from front to back. Your toes should feel free. They shouldn't get cramped. When you come to the mid portion of your shoe, it should be again comfortable. If it grips too tight, then you will land in problems. If you're running, then you should not have a high heel counter. So if you look at the back of your shoe, the whole thing slopes up.
Right.
And you want to have a flat heel counter. You don't want to have a tall heel counter. If you're playing basketball, you want to have a tall heel counter.
Okay.
So these are the 3 things that you want to look at. If you're into long distance running and if your foot is overpronating, you want to take the shoe and you want to bend it. You want to make sure that it folds up at least about 60% on itself, so that it becomes a very nice way in which your foot doesn't break, so as to say, when you run. So that's someone for a runner. If you change the type of sport, then of course the prescription for the footwear starts changing. Then you need to look at half spikes or full spikes. If you're playing soccer, then there are different shoes. If you're playing on turf, there are different shoes. If you're playing on the field, and that's one more cause of injuries that I see in my practice. I see a lot of torn knee ligaments
Right.
with a lot of these young kids and even older kids, so as to say, who play soccer over the weekend. They go and play on these artificial turfs, but they're wearing the football field shoes, or they're wearing the running shoes on turf when the surface is a completely, totally different ball game.
That's a
So
great
just
point.
in addition to what he said about the shoes, I completely agree with it. But there, in addition to proper footwear, they have to be the protective gears. Some people are more prone for knee injuries. I've seen this. So they should wear the proper kneecaps, the knee braces.
Correct.
That's very important. You have the elbow supports. You're playing cricket, you need to have the shin guards. And I think that will definitely help to prevent injuries. All these protective gears are about injury prevention.
Right.
Because sports and injuries will go together. And how do you prevent injuries? Proper footwear, proper protective gears, proper warm-up, and all these things are very important to prevent injuries. And I cannot overemphasize the use of these. People feel, why should I spend so much on a good shoe? Of course, what Sachin said is absolutely right. More expensive doesn't necessarily mean it's the best shoe.
Yeah.
But of course, with a proper sole which will definitely take away the impact, because majority of the ankle or the knee injuries are because of the impact while running, while that sport.
Absolutely.
So the shoe should be able to absorb that impact. Proper footwear, in addition to that, proper knee braces, shoulder caps, and all those things are very useful to prevent injuries.
No, I agree. And I think also the point that you guys touched upon is, my family plays a lot of tennis, right? So clay court versus hard court.
Yeah.
Just making sure
Yeah.
that when you know where you're playing, you switch your shoes and,
Absolutely.
whatever protective gear you need
Absolutely.
accordingly.
Yeah.
These are small things we know,
Yeah.
but we don't take care, and then, bhugatte hain jab injuries hoti
Exactly.
hain.
And even if you're running, Namita, what's very important is
Yeah.
that if you're running more than 5K every day,
Yeah.
you need to have 2 sets of shoes. You need to have 2 pairs and use them on alternating days.
Oh, really?
Yeah, because it's the property of any material. When you run, it gets deformed. If it goes to a certain limit, that's called elastic deformation, it returns back to normal.
Okay.
When it goes beyond that, it goes to a plastic deformation, which may not come back to normal. You keep using the same pair over and over again, you might land in problems where you might lose the shape of your shoe, and then that may be an issue. So it's always good to have 2 pairs of the same shoe which you like using and use them on alternate days.
And how, like how you say, how soon should you be changing your shoes? Because your shoes look as good as new.
Yeah.
So, the conjuice in you is like, "Arey, aur 3 mahine chal jayenge." So if
Chal
you're a
jayenge.
running kind or whatever, like, is there a lifespan of the shoe for certain sports?
So if you look at from the top, if anything of your stitching has got ripped off and it's not feeling the same, yes, it needs to go. But if you look at the sole and you feel that the grips you've lost out grip, or a lot of people who overpronate will feel that when they look at the back of their heel, it sort of wears off obliquely. So
that
once
is a
that
good
starts
point.
happening, it starts setting in. That means that the moment you run, your foot doesn't land exactly the same way. And now you will start loading, not now, but you'll start loading your spine and your knee in an improper way, which may then lead to problems later
Absolutely.
on.
Just
Yeah.
to add to that, what I always do when I have sportsmen, I actually ask them to remove their shoes and see the insole inside and the outside. And there are certain areas which have worn off more. So whichever areas have worn off more means they are having the brunt of the impact while running.
Correct.
So then they have to change the shoes. And otherwise, what Sachin touched upon is do the pressure measurements. There are certain force plates you have, and you can actually find out, because of the different types of feet which are there for each individual. You have to wear that kind of insoles, and now you can get customized insoles to your pressure measurements, and that really helps. And I have seen that the athletes really have less injuries once they have a proper footwear.
And they take care of that.
Yeah.
Absolutely. So, I mean, we socialize a lot, and we're
Yes.
all getting up there in age. And we've seen a lot of our friends who probably are in denial about their age and still playing at the same intensity sports that they were playing in their 20s. And then ending up with a lot of painful surgeries. So, as you age, is it a number in your mind, or do you really need to take precautions when you are doing recreational sports?
So I think the number is an important thing, because you have to have certain guidelines. Sachin did mention about 35 as the age, but what I would say generally after the age of 45 or 50 is the time when your body is undergoing major hormonal changes, biomechanical changes, and you've got to really take a lot of precautions after that particular age, if I have to put a number to it. But definitely a physiological age might be different than a chronological age. Certain individuals, athletes age a little later, and certain age a little earlier. So that leaving apart, 45, 50 is the one. And what do you take care when you cross that particular, age? I think there are 3 things which you need to take care. One is your muscle mass. What happens is it suddenly starts going down. So you've got to do exercises which are going to build up your muscle mass. And again, I'll just bring in nutrition here. Make sure you have enough proteins to take. Otherwise, what we call as sarcopenia, the muscles suddenly slow down. They become wasted after that particular age, especially in the women when they are going through postmenopausal changes. The second is you need to improve your cardiovascular health. You are running maybe 7 kilometers, 8 kilometers. You need to kind of slow down and make sure that your cardiovascular health is good. And the third is the mental makeup. Certain things have to be changed with age. And we've seen that after the age of 50, 55, the impact which your knee could take when you're 30, 35 is definitely different. And the bone cartilage starts wearing off so soon. So you've got to take care of that, and mentally you should be ready to accept certain changes. So these are the important things, your muscle breakdown you've got to reduce, your cardiovascular health you need to improve, and the last thing is your mental makeup to make sure you do all this. Because people, especially if you see the professional athletes or the professional football players or the soccer players, once they stop playing, they just deteriorate because they've done the exercises, they've pumped up, and they're completely mentally geared for that sport, and they do it. Once they retire, they just degenerate their knees, their shoulders, and we've seen so much of that.
That's probably what you spoke about, the overuse
absolutely.
part.
So
Possibly, yeah.
overused.
age gracefully is
Yeah.
very important, and to slow down and to make sure you make these changes is very important, Namita.
No, that's fabulous. And Dr. Parag touched upon a very important point,
Yeah.
post-menopause
Yeah.
or the menopausal stage, because the more we, women's health, we think about, there's a lot of osteoporosis, bone health, and especially fragility
Absolutely.
fractures
Absolutely.
increase tremendously. So any special tips for women who are sort of getting menopausal but at the same time want to have a very active life in terms of recreational sports?
Sport is actually good to decrease the effects of menopause because any form of weight bearing or impact exercises
Correct.
will actually help improve your bone health. So let's look at the preventive aspect of it. You should go out there and exercise, but give a sufficient time interval for your body to recover between 2 successive workout days. So maybe try and do a resistance workout every alternate day. Try and do your cardio workout every alternate day. Don't try and mix too much in the same day. Pay extreme good care and attention to your nutrition, which is also very critical now, especially that you're going through these hormonal changes.
Right.
And of course, maintain a very good mental balance because that's going to help you tide over this whole crisis where you're going to go through some form of hormonal changes, which may be a bit difficult to handle if at all you're not in control of everything.
Right, and most of your physio, like I've had a lot of physiotherapists from both of you come to my house for multiple things, and it's always a lot of yoga. So I feel like instead of having a physio come and do that on you, why don't you do it as a prevention? And
Absolutely.
I don't know if the two of you do yoga, but I'm a very big believer.
No, I do yoga. I do 3 days a week yoga and 3 days a week
Because it's basically
gym.
stretching and
That's
toning and building
very
strength.
important. Yeah, but just to add on to what Sachin said and
Yeah.
what you asked post-menopausal, what we should do, whatever Sachin said, of course, is important. One more thing which you can do to have a direct quantification of your bone health is doing a bone density test. And I find that very useful and very accurate, where you measure your T-scores. And if that is showing any variation, then you've got to take definitely calcium supplements along with vitamin D. So, post-menopausal, one should undergo what we talk as a bone health checkup. We all do
And
cardiac
trust me,
checkups.
I'm guilty. We don't do it.
Absolutely.
Yeah.
So that
We
should be done,
procrastinate,
and
we don't
then
do it.
go to a doctor and
Yeah.
completely correct your calcium, vitamin D, or whatever it takes, because that's going to really make your bones osteoporotic, and then you're prone to so many kind of other issues.
Absolutely. No, this is fantastic. Any parting words from the two of you? I think, injuries in sports is such a wide topic.
Yeah.
We managed to cover a bunch of different aspects, but anything you'd like to add as parting words before we wrap up?
Just to end, what I would say is sports injuries are preventable.
Yeah.
Take care of your, what kind of sport you're playing, what kind of nutrition you have, what kind of sporting gear you have. Be careful, do proper warm up, cool down, listen to your coach. Don't just be in that mood or in that kind of tempo where you overrule your body's signals. Injuries are preventable and they can be prevented to a large extent. But even if you have them, don't worry, they are curable. Sachin is there to take care of the sports injuries, and I am there, and we'll make sure that even if you have injuries, you can get back to your pre-injury level of sports.
Fantastic. Dr. Sachin, your parting words.
I think, Parag mentioned it absolutely accurately, and he did
Yeah.
make a point earlier on. Listen to your body.
Yeah.
So I think just keep your eyes, ears open, get the inner signal from you,
Yeah,
and
yeah.
do all the modifications to tide over the crisis.
Get the right doctor, go for the annual checkups. I think this
I know.
is extremely
Have the
important.
right nutrition, and there you go.
And there you go.
It's a
So this
wrap-up.
is fantastic. A lovely episode yet again. As somebody who has zero motor skills and athletic bone in me, but in a family full of athletes from my parents' side and my kids and all, I have seen so many injuries, and they're very traumatic, very troublesome. A massive rehabilitation time. Why not prevent it? like these lovely doctors told us, listen to your body, get your annual checkups done, pay attention to your nutrition, your shoes, your sportswear, get the right coaches, get the right doctors on your side, learn the right techniques, don't take it for granted. And of course, as you're aging and getting menopausal like me, take that extra care. So with that, we end a lovely episode. Thank you so much.